Before a smile changes someone's life, there's always a story behind the dentist who created it. Welcome to Beyond the Dental Chair. I'm your host, Dr. Syeda Andaleeb Zaidi. This is a podcast where we sit down with dentists, innovators, and leaders to talk about the journeys behind their careers, the risks they took, the lessons they learned, and redefine what it means to build a meaningful career in dentistry. From clinical excellence and entrepreneurship to leadership, personal growth, and the evolving future of dental care, we go beyond the operatory to uncover the journeys behind the professionals shaping our field. If you're a dentist, student, or someone passionate about the future of healthcare, you are in the right place. Because dentistry is not just what happens in the clinic, it's about the people, the purpose, and the life we build beyond the dental chair. And today I'm really excited to be joined by Dr. Gargi Roy Goswami is a dentist turned science storyteller whose work stretches far beyond the dental chair into cancer genetics, saliva diagnostics, and the art of making complex science accessible to everyone. A founder, researcher, and educator based in India, she established the Indian Academy for Clinical and Dental Genetics, the first academy institution in the country dedicated to dental genetics and saliva diagnostics training. She also co founded the International Saliva Summit of India, bridging researchers across dentistry, genomics, molecular biology, and biomedical engineering in collaboration with the North American Saliva Symposium. Her research focuses on oral cancer genetics and the diagnostic potential of saliva, work she believes could transform how we detect and monitor disease. As a science storytelling strategist, she helps healthcare and research leaders translate their breakthroughs into stories that resonate with wider audiences. When she's not in the lab or at the mic, Dr. Gagi is a professional Kathak dancer of the Jaipur Gharana tradition, a painter, and a passionate advocate for interdisciplinary science education. She joins us today about what your saliva might know about your health and why dentistry might just be the future of diagnostics. Welcome, Dr. Gargi.
Thank you, Dr. Saida, and it's a pleasure to be here on your podcast. And thank you for the generous introduction. Mentioning my Kathak was a surprise to myself as well, because, yeah, I mean, I have been always a passionate dancer. May not be doing it right the moment, but yeah, thank you so much.
You're welcome, Dr. Gargi. Actually, as dentists, we just focus on the profession so much that we forget we are much more than just being a dentist. I think I like to introduce a whole person. We achieve so much beyond the dental chair, and I hope to uncover some of it in this podcast today.
Sure.
So, Dr. Kagi, you wear so many hats: dentist, genesis, science communicator, dancer. How do you introduce yourself at a dinner party where nobody knows what saliva diagnostics mean?
Okay, so that's a very nice question. Well, I introduce myself in a dinner party. What I would love to introduce where nobody knows me or doesn't know what is saliva is in a very simple way. So I tell that I am a saliva research expert. So what I do, I teach doctors, scientists, and researchers how to use and explore saliva as a sample for disease diagnostics and prevention. So that's something in a very simple way I'd like to introduce myself when it comes to saliva. Yeah.
So, when did you realize that dentistry was only the beginning of your story?
Okay, so I need to be a little bit elaborate in this answer, if I may,
Yes.
if your time permits, because my story haven't ever started in dentistry. I'm very vocal about it. I never wanted to be a dentist, by the way. So, because my full family, my father was the first dentist from the town which I belong from in West Bengal in India. It's a small town, but very historic, Murshidabad. So, he was the first dentist, and I have grown up playing with casts, the films, X-ray films, and all those stuff. So my journey started as a molecular biologist. So I never wanted to be a dentist in terms of not that I hated dentistry, but more that I was a rebel child. So wanted my own identity. Since my dad was very, very famous, and of course he is my hero. But then back then I was like, okay, if I become a dentist, everybody calls me by your name. So how do I build my identity? So I started my journey with being a molecular biologist, went ahead to study genetics, always research has been something which still intrigues me. And then I worked as a scientist in Jawaharlal Nehru University in India, in New Delhi, and also IIT Kharagpur in India, all premier institutions. And then when and again my research career was as a molecular biologist. I was a cancer genetic specialist. Well, then, life always has some turnarounds to give to you.
Mm.
And then, due to my dad's health going down, and I just wanted to support him. So I landed up in again doing another undergrad, which is dentistry. And that's where it intrigued my mind. And I think that's the beginning of my story, where I found that it has dentistry, the way we are being taught or we are being practicing. I think the whole picture is not in front of us. It's a very it's not presented in the right way. It's not taught in the right way in terms of I'm trying to tell here about bridging clinical research
Mm.
and the dentistry itself. So that's where my first startup came up, when what you already mentioned is dental genetics, where I just tried to bridge the gap, because there's a lot of scope. And as dental students or professionals, we need to understand not only the physiology or pathology as a clinician, but what exactly is going inside, because whatever we treat is its symptoms, but the disease starts way
Mm.
beyond the symptoms appear. Yeah, so I think, sorry, I think I I gave a little
It's
longer
okay.
answer.
It was fascinating to know your journey. Usually, after doing BDS, people, they move on to other fields. I think you came from the other field into the BDS. That is something new. Like,
Yeah.
but, and you are right. Research is not taught to us until we are in postgraduate. The first brush with is when we are in postgraduate, we do a paper or a thesis. That is the first time we do research. I think we need to encourage young students from second, third year to participate in research, to think beyond the usual procedures, and start something of their own, like to think out of the box. That is where
Of course.
we'll actually advance the dentistry.
Yeah. So basically, I would like to add on what you said. I think the approach of teaching needs to be upgraded. That is for sure.
Mm.
I'm not sure if somebody would like this statement or not, but I'm very vocal about it, because since I've seen both the education systems, I mean, both the worlds in terms of the subject. So you know what, research is a mindset. Research is not something like a subject that you start learning only when you are in a postgraduate. For
Mm.
example, when we are in dentistry, we are taught to take a case history in the third year, right? So that's our beginning of oral medicine. We are taught to take case history of patients. That
Yes.
case history itself, it's the beginning of your research. So just pulling up your student data or OPD data, you can understand lot of things that probably we are not taught how to look into it. For example, if you are in a place like I talked about my place, Murshidabad,
Mm.
I practiced as a dentist for 3.5 years only, because research and laboratory always pulled me more. So when I was there, it is, as you can understand, it's a rural oriented place. I used to see lot of cases on a daily basis of leukoplakia, or those
Mm.
kind of early pre-malignant lesions, right?
Right. Okay.
So I also ran certain school dental health programs. This typical way that we actually read, write our
Mm.
questions in the exam and go out for public health. But those things, if we can really implement, what I saw from a data, that there was a rise in incidence of this
Mm.
kind of diseases. So, just from a patient OPD data, you can actually understand many things about a disease, particularly if I talk about oral cancer or pre-malignant lesion. So as a clinician, when you bring up, if you know how to look into this data and bring it out as a publication, or even as a normal communication post or a blog outside, it is a huge contribution to the science field at itself, also to the industry, because there are a lot of entrepreneurs or people who are every day looking for ideas, and they are extremely intelligent people, and they can turn those insights into real world solutions. So my passion is always about translating research into practicality, which helps people. So
Wow.
yeah.
Okay.
Yeah.
Actually, if documenting what we saw is one of the major ways to start research, yes. So, ma'am, you founded the Indian Academy for Clinical and Dental Genetics, the first of its kind in India. So, what gap were you seeing that nobody else was addressing when you found this?
Yeah, so as I said, as I started my journey as a researcher, so since I have worked as a scientist inside the lab, it's not just theoretical that I have studied. So I had the opportunity or privilege to be inside a lab working with the real oral cancer cells, seeing them under the microscope every day. Now, when I came to dentistry, the funny part is when I was a molecular biologist or a cancer genetic specialist, I never went and saw how a cancer patient looks like, because
Mm.
that was not required at that moment. I used to get samples from AIMS or other places, and we just used to process and do our stuff. But when
Okay.
I came into dentistry, got trained as a dentist, and I started practicing in my rural place also, that exposure, that how really it symptomatically looks like, how clinically it is, that was the point when I found that, oh my god, we are not even talking about it in dentistry, because the molecular aspects, the genetic changes, it has started long way ahead before even any speck you can see on your mucosa or wherever, right? So from therein, also I closely worked with postgraduates, like even as an intern, as a student, as a dental student, we all know we get postings in different departments,
Mhm.
particularly the department of oral pathology, oral medicine. These are places which triggered my mind more, because I am seeing students, particularly postgraduate students, who
Hmm.
are doing thesis work, who are talking about PCR, but they are not aware even how to analyze or whether that report that is coming from the lab is correct or not correct. That was like, what the hell is going on here? So I just then thought that somebody has to speak about it, and somebody has to do something to connect this. Probably I understand that the way, at least in India, how we study dentistry, it's all technique focused, and I completely appreciate that way of doing it, because we really need to treat patient. But at the same time, it's not just working with those forceps and tools and injections and your elevators. It is beyond that. So if I thought that if I can empower and share whatever knowledge I have, packaging it into dentistry,
Hmm.
then I think a lot of young minds would come up. So that's where my journey started. My first startup was about dental genetics, bridging the clinical research, teaching people, or talking about genetics, how we can apply it in dentistry and enhance the dental research aspect. So yeah.
So, ma'am, I think genetics do play a part in cancers.
Oh my God, that's where everything lies. It's all about genetics. It's all about genetics. You can't go away anything away in hand without genetics. It all starts there, right? Whether it is inherited, or you are it's acquired things like, because most of the cancers are not hereditary; they are acquired
Hmm.
from the environment due to habit. There's a lot of factors. So it's all genes. It's all genetics. We can't even open our mouth without that. So that's where my intention with the startup, or my intention still till date, I am not here to make a dentist a molecular biologist. That is not possible. Okay.
Hmm.
uh, and I don't intend to do that, but my point is, if you as a clinician is looking into your day-to-day data, you should have a little broader aspect of looking into it, so that you are able to probably collaborate with another molecular biologist, speak their language, and do good research and do good scientific innovations and put it out in the world. So to understand the language, we need to have a basic knowledge. My entire intention with the startup, bringing up courses or fellowships that I still run online, is that that you become aware of what is happening. You don't have to leave everything what you such a pain we take in 5 years in dentistry, right? I mean, I was I became from micro to nano to macro. I mean, from lab to dentistry in patient's mouth. But then, that that coherence, that gap of knowledge, I feel it is still there, but I think it's a very good time that we are into at this era. A lot of people are talking about it, and particularly the young generation. I really appreciate their curiosity and inquisitiveness, and I just think that just a spark could lead to a lot of fantastic innovations. So that's where my mindset is when I always talk about bridging the gap.
Yes. Actually, innovations take place when you know something is possible.
Yeah,
You don't know what you don't know. So
exactly.
making the link is an essential part. Get educated is an essential part to do something extraordinary.
Absolutely.
So how does a dentist end up becoming a saliva expert? Walk us through your journey.
Yeah, so generally when we work as a dentist, saliva is not our friend. We want to get rid of saliva because of our field should be clean and
Yeah.
all that stuff. So it's a different perspective of seeing a same thing from a different window. So if you talk about how a dentist could become a saliva expert, it is just a matter of time that they learn, they know the subject, they look into saliva not as a foe but a friend. Because I personally believe, though I come from a very strong academic basic science background, I
Mm-hmm.
personally believe if dentists, particularly dentists, take up the role of being saliva experts, the world is going to change very, very quick. Because what happens is, as dentists, I'm sure you know that when we look into the mouth, we are actually looking into the entire system. Because any chronic disease or any disease for that matter, say it is diabetes or whatever, those kind of things, just by looking into the gums, by looking into the teeth condition, looking into the oral mucosa, we have so many insights, we know what is it. And all these things, when physiology moves towards a pathology, as it is present in your blood, the biomarkers, the molecules, the same thing is present inside saliva. So and if we can explore saliva more as dentists and push towards more diagnostic innovations, that changes the world. Because the best part of saliva, it is non-invasive, and it has no limitation that you cannot take saliva from an infant, take saliva from a very geriatric patient, yes, or a elderly person. So it's just like, I mean, it's so easy to grab that sample, and it doesn't actually touch any cultural barriers that way, if you see. So
Mm-hmm.
because in India or even over the world, particularly I talk in perspective of India, because we are culturally very diverse in terms of religion, in terms of rituals, so there are a lot of things like that. Even if you see the cost, even if you see the pain, for me, for important, most important is the pain part. So
Yeah.
pricking a child, pricking an infant, it really hurts me. So taking a saliva would be easier. So yeah, so I would put my answer that way here. Yeah.
So how a regular dentist can implement it in their clinic, ma'am?
Okay,
Uh,
so there are a lot of things here. In India, we are still in the research and development phase, but lot of good work is happening where, you can implement saliva diagnostics inside the clinic. If I may just put just simple things of saliva, forget about looking into it in a molecular aspect, or quote unquote all those molecular biomarkers and fascinating terminology, because that really needs a kind of path of research, and you bring a product, make it marketable. That's a whole process. But how, as a dentist, I can add more value? Simple biophysical properties of saliva will give you amazing information. For example, the pH, for example, the viscosity, the consistency, the color. There's lot small things, the flow rate. Okay, it
mm,
gives lot of information. Because saliva is not a separate entity. We must understand this. So how I explain saliva when somebody asks me, okay,
Hmm.
why, what is saliva? For you ask me what is saliva, for me, I'll give you an example of making tea. Okay.
Hmm.
So if you take water, boiling water, put the chai ki patti, put some masalas, and then you start boiling it to get the concoction. Well, that entire thing is blood. So after, if you want a very good tea, you have to take a strainer and filter it out. So saliva is basically the filtrate, if I may say, of
Okay.
everything that is inside your body. So whatever things you have in blood, everything we have in saliva. Yes, there are
Hmm.
pluses and minuses. Some molecules would be more stabler in blood versus saliva. Some would be more in quantity in blood versus saliva. If we just put that aside, everything that you have in your blood is there inside saliva. That's why it is called mirror of the body. Saliva is known as the body's mirror. That's the reason. So that's what excites me all the time. Yeah.
So, ma'am, are there actually any tests that we are doing right now with using saliva?
Yes, there are a lot of tests. For example, I would not say that it is a specific for dental problems, but people are coming out. Companies are working on it at this point in India. Uh, well, there are tests which can use which uses saliva. These are mostly genetic or genomic tests. There are tests which are called as pharmacogenomic tests, which also use the swab or the saliva, where what happens there is basically you can get predictions about many futuristic chronic diseases, including several cancers or any inflammatory diseases like arthritis and stuff like that, where you can get a futuristic prediction that whether a person is has the propensity or tendency to get it or not. So, and then if you know that, then what to do. So there are a lot of companies who helps in these areas. Also there are companies who are working with saliva in terms of identifying the role of oral microbiome, or how the oral microbiome gut microbiome is related, particularly in the nutritional aspect. And I told about pharmacogenomic tests. These are nothing but you can use saliva and see that about the drug profile of a person. What do I mean by that? It means that for example, today if you see in modern medicine, what we do, it's a hit and trial. It is, or rather, trial and error method, meaning to say, suppose a person who has diabetes or just started on diabetes, as a physician or a specialist, I would give metformin, right?
Yes.
Until and unless that person is taking the medicine, going through the entire dosage, I don't know whether that medicine is actually working or not.
Working for them.
Probably that person might be resistant to metformin genetically, because pharmacogenomic test gives us that data, that powerful data, where we know if a person is a good metabolizer, bad metabolizer, or resistant to a particular drug. So this kind of test we can do just by collecting spit. I mean the saliva. You just collect, send it to the lab, and the scientists will do their job, and you get the report. So I feel that if we can empower young dentists, or even practicing dentists, even existing dental practices, about all these things, so a lot
Hmm.
of collaborations can happen. You don't have to come up with a genetic test of discover a genetic test of your own, but you can always collaborate, and that's how you serve more to the society. And if I may put, because I'm an entrepreneur, I always talk about business, so it also adds value to becoming a little bit separate from the crowd as a dentist. And you can also definitely add to your revenue streams with
Hmm.
whatever you're doing along with dentistry. So that is something I always see, that there's a whole circle picture that exists, but we just need to speak more about it. I'm talking about it for the last 10 years. Let me see. In next 10 years, I'm sure a lot of things will change.
So, how do dental practices get in touch with these companies, ma'am? Like, where do they
Okay, so
sign up, or what is the
I
procedure?
don't have a direct answer to this, because for me, I'm a facilitator, I'm an educator. So people can come to my courses that I run. They can come for consultation where I can help them in connecting to these kind of companies. And third and most important, and I'm very always very my eyes become brighter when I say, is to attend the International Saliva Summit that I do in India, because I have been doing it for the last few years now.
Okay.
From 23 to 25, I took a break, and I'm very proud to announce that I'm doing it in an in-person format in um, December in Bangalore, which is in Karnataka in India. December
Yes.
5th and 6th, I'm doing the International Saliva Summit. So in this conference, what happens? Many people from all over the world, different types of experts who are working with
Mm.
saliva in different aspects. Not only it's about disease, it's about lot of things. Okay, it's about addiction biology, it's about environmental toxicity, it is about neonatal area. I mean, it's just
Vast
gives
field.
me goosebump when I talk. So you can always explore these platforms, because my intention is all has been always to create a platform where collaborations can happen, right? And
Mm.
as a expert myself, I am always open to consultations, coaching. If somebody really wants to get into this field, I'll be happy to help them.
Yes, ma'am. Actually, people need some guidance to get into this. I think you are a great person to go to, because not even I am shocked about hearing all these things that can be done with saliva. So I'm
Yes.
sure the knowledge is base is very less regarding this in our society among dentists also. So I think having a person to go to if you are interested in this, then it will be really beneficial to the society at large, not even for the dentists.
I run a, I mean, I think I just started this year. I run a Salivonomics free talk series on LinkedIn, particularly. I posted on my YouTube channel also, but I'm more a LinkedIn person. So if somebody wants to follow that, there what happens, like different experts, they come and talk about saliva, different aspects of saliva. So you can always,
Gain more knowledge.
do it.
Yes.
Yeah, yeah, it's very, very useful actually. I also learn from all those conversations very much. Yeah.
Yeah. So we'll add the description to this to the
Definitely.
YouTube. Yeah.
Definitely.
So I said International Saliva Summit of India. It bridges dentistry, genomics, biomedical engineering, and more. So why does that interdisciplinary conversation matters so much right now?
Well, if I have to answer, as a human body, we are interdisciplinary. So it is not right now. It
Yeah.
is the way nature has made us up. So when we come from the background of science, or we try to see and help people in as doctors or dentists, I
Mm.
always believe in one thing is about holistic approach towards health.
Yes.
So if we really want to build the societal health up, so
Mm.
we need to prevent diseases more, rather than getting into it and then, getting solutions. Of course, that is very important. But are we really focusing on early diagnosis? If so, how much?
Yeah.
Whatever we have today, if you see in and around the world, in any specialty I'm talking about, I'm talking in a very general way, right? It's all after the disease happens. What
Yes.
about if we could do something before it happens? Because that's where we save lives. Forget saving lives, we are pushing away the disease, we are adding some healthy lives to the person. And that overall, if we see as a population, we are actually adding to health to the entire society. So I
Yes.
think the conversations, uh, there's a lot into it, Dr. Saida. The conversations, the policies, the awareness, there's a lot of work, and I don't believe it's a single man's work. It
Yes.
will always happen in a community wise, when many people talk about the same thing, more vocal way. I think that's where we need to work more as communicators. I think that is what I feel.
Yes, actually, you are communicating all the research to the common people being a science storytelling strategist. So, I think the importance of storytelling in this is, even for a dentist, understanding it is a bit difficult. So, converting it into smaller stories, or how do you convert it so that a common man can understand it?
Okay, so there are a lot of strategies and there are a lot of frameworks when it comes to storytelling.
Hmm.
Uh, Honestly, if you ask me, if I have to give you a very honest and frank answer, I have been a natural storyteller from childhood. So I have been writing in my school magazines, talking about things like that, and science has always intrigued me in my mind. But yes, we do have formats. I'm not telling that you have only people who are natural storyteller can tell stories. No, there is a strategic path to it. There are frameworks, formats, okay, which you can learn and you can implement, and it's just a skill. If I can do it, anybody can do it. It's nothing a rocket science here. So first, two three things I can add here, just to answer more specific to your question. Like, you asked me how do I simplify things. First of
Hmm.
all, there are three things that you, as a communicator, or if you're telling that you want to put it as a story, you have to think two three things. First, what is your objective as a person? Why you want to do it? That why has to be answered by yourself. Second, for whom? Are you targeting only normal layman people? Are you targeting healthcare professionals from your domain? Are you
Hmm.
targeting people who are policymakers? Are you targeting investors from where you want some funding to come in and fund your research or innovation or whatever? So this question is very very important, because storytelling or the techniques or frameworks are green principles, but as a communicator we need to learn and understand how I can curate the same research. Suppose it's a very typical research published in a paper. Suppose
Hmm.
you are a prosthodontist. I don't know too much about prosto, because I just studied. I'm not a specialist dentist. I'm a general dentist. So there's a lot of things in prosto. You have published a paper. So now if you have to crack that down and bring it up as a story, so are you telling it to me, who is also from the fraternity, has some knowledge in prosto but don't know the nitty-gritty? Are you telling to another patient? So these questions, the audience, what I'm trying to insist here is, for whom you are putting out the content, that is
Hmm.
very important, your audience. And the third thing is, what is it that you are looking up to? Meaning to say, are you trying to give a direction to your audience? Are you trying to tell them that, show them some kind of benefit out of this story?
Hmm.
Or are you trying to actually just make them aware? All
Okay.
these things sounds very similar, but
Hmm.
has very subtle very subtle demarcations.
Okay.
So as a whole, we can always learn these things, and
I
then it's
think
good.
these three parts determine the language of the story that we are
Yes,
going to tell.
absolutely, absolutely. The
The-
tone, the language, because when you are writing it for for example, a drug discovered for cancer, it's a clinical trial, and for example, a pharma company wants you to write as a white paper. There, you cannot just go and it has to be factual, realistic, just like writing a research review publishable research review paper. How we write it, the language should be that. But same thing, if I'm going on social media, making a video for just my family, friends, or layman public, basically,
Hmm. Hmm.
that entire game changes, right? The entire storytelling format changes. Those things are very important to not only understand, but there are strategic steps in it. There are frameworks which I always tell that you should learn and then do it. If you know, very good. You can always try out your own things, because as a writer, as a communicator, we all have certain perspectives which are very unique. So,
Yes.
but the steps, the basis, the frameworks, this needs to be learned.
Hmm.
That's my
Can you
perspective.
elaborate on one framework, ma'am, for anyone who are getting into storytelling?
Um, well, that's little difficult, but because I need a context for that. So, for example, mm,
Like you are telling the importance of saliva to a dentist. How would you approach it?
yeah, that's very easy, because for me, I don't have to make a story to teach a dentist about saliva, because that person is already aware, comes from a scientific background, they understand the nitty gritty of the subject. What I have to do is just to simplify. Say for probably I want to tell them genetics or genomics, so that
Hmm.
becomes little complex for them. So probably I will just take up those cues which will be easier for as a dentist to grab, and I would show them that if you learn this subject, how you can actually add value to your practice as well as to your patients. That's a simple approach I would take if I have to tell about saliva or using saliva diagnostics or coming into saliva diagnostic field, along with your clinical practice. So that would be my very straightforward approach. Okay. So yeah.
So, what's the biggest mistake scientists make when trying to communicate their work to a wider audience?
Okay. It's a favorite question of mine. The biggest mistake we do, I tell we because I belong in from, we all belong from that community. First thing is, let me be very bold and straight. I'm going to make a statement. If you want, you can edit it, but I love to talk like this. That is, we have some ego of our own being knowledgeable. We are
Yes.
doctors, we are dentists, we are researchers, we have done so and so. I have done 150 molecular cloning sitting inside a tissue culture lab. I'll tell you something. We need to come down to ground. As a science communicator, first thing we need to be grounded. Next, answering your question that how I can talk to the layman public, right,
Mm.
about
Yes.
a certain thing. So, as I said, I need to understand that here, if I want to show myself as an authority, it's not a very good idea if I am using jargons which nobody understands. I am feeling very good about it because molecular cloning, genomics, oh, it gives me that ooh factor, but nobody is understanding. Then my purpose is
Mm.
not served. So, instead of using technical jargons, being a little bit of, I use this term egoist. Let's
Mm.
come down, be grounded to the at part to the person to whom I want to tell. If I am talking about some disease, um, and best practices, talking to a blue collar staff, I have to understand as a communicator his or her psychology, the language that I have to speak, that they understand. That's where is my success. Not going and telling them, Array, if you do this, this is mutation, this is that, they, I
They'll
mean,
not.
nobody will understand. So my point is that first be grounded, see that what audience you are catering to and what language plus
Mm.
psychology of your audience is. So as a communicator, you need to have lot of perceptions about this, and for that you really need to work on yourself. So whether you have a doctor degree, phd degree, postdoc degree, lot of
Mm.
experience doesn't matter. It matters how good you are in simplifying the language what your target audience understands.
Like the chai analogy you used to explain the importance of saliva, I think it would be a great example to, making general public understand the importance of things.
Absolutely.
We need to use the analogies that they are familiar with.
And I think a good way is to give when you are talking about anything, is a good way to give examples which usually we see in our daily life, right?
Yes, yes.
So I can tell you, I will not tell you, I mean, I don't want to go into detail, but just giving an example. All my like sessions when I take, the I mean the workshops what I do on saliva diagnosis, even if you go to my online courses which stand out there, you will find genetics being compared with t-shirts, because that's something which is very very easy to say, making them understanding is very easy. And secondly, I think visual, giving a visual to a person, it
Yes.
always, because our brain registers that way, right? So
Mhm.
if the comparisons could be something from the daily life that we are using. So DNA
Yes.
fingerprinting, if you tell me to explain in a simple way, I will give you an example of Mumbai station and one um, very healthy or obese person plus another very lean and thin person moving through the crowd. So that would be my example. I mean, cutting through that Mumbai ka platform ka bheed and getting into the other side. That's the basic principle of DNA fingerprinting. So see, if I just tell you in terms of molecular biology, it will, as a doctor also, since you don't belong from that expert field, you will not understand if I just start speaking in my language. But if I give you this visual, you will quickly, you can imagine, you can visualize, at least if not everything, you will understand the concept. That is
Concept.
more than
Yes.
enough.
Yes, that, like it will be a start to dig deeper.
Absolutely.
Uh, so, ma'am, you co-founded Salsi with the corporators from the US.
Yeah.
What did bridging India and the global saliva research community look like practically?
That is an amazing global community we have. Of course, I would always say that compared to any other field, the global community of saliva, people who are enthusiasts like me, it is small. But extensive work is going on, and not only Saliva Summit, the entire concept of this conference started with my good friend and another mentor friend, Dr. Jill Maron and Paul D. Sloy. They are pioneers in this field. They came together, and particularly Paul has always been a pioneer in this field. I, without mentioning him, I can't leave this conversation. And when we're talking about Saliva Summit, so they started it in 2014 in North America.
Hmm.
So now what happens is, in different parts of the world, like Brazil, we have our good friend Deborah. There are a lot of organizations also which we are doing. In Italy, it happens. Then I think Canada, it happens. So in different parts of the world, people, Australia, I can't forget Australia, yeah. So
Hmm.
like this, in different parts of the world, there are global groups, in their own best way they are doing. There are associations which are promoting it. If I may put, definitely I have to talk about the IADR, International Association of Dental Research. They
Hmm.
have their own saliva diagnostic forum itself. So lot of work is going on around the world. So what happens is, with this saliva summits particularly, we are all trying, as enthusiasts, we are all trying to spread awareness. Bringing these conferences in different parts of the world is just that we are trying to cater to that population, because not every time everybody can go to some other part of the world, and we all do it in our own independent way, because I understand India better than somebody who is in than an
In the
Australian, right? So that's how this is curated. And I think it's a very collaborative approach, with researchers, scientists coming up, industry, lot of support. We are seeing in present. I mean, it's growing. Just that I think more people take this up in their different regions would be something which we envision.
Yeah. Ma'am, what advice would you give to a young dental researcher who is interested in saliva and interdisciplinary science but doesn't know where to start? Where do they get the footing for this?
Okay. Please go and take up and search in PubMed or Google about saliva, a review paper. Just give this keyword. Please go through once what saliva is all about. And we study saliva in our physiology very much. Go back to the to the basic first year or second year physiology book. Read about saliva. That would be the start point. And also you can search things that are going on around in saliva. I would definitely urge people to follow my work. It's not that I'm trying to be, being kind of very vocal about what I do, but that's mission of my life. So I do a lot of stuff. Also follow people, find out all these associations. It's all available on Google. I mean, it's all there on the internet. You
Internet,
see the
yeah.
associations. I just know I mentioned International Association of Dental Research. You see a lot of stuff that we have put out content. There's a lot of talks that I have done before, which are all available for free. And if you want a formal basic training, I also have a course that runs online on autopilot. Anybody can join that from any part of the world. Anytime you can take it up. It's an online course, it's a recorded version of the course. You will have a basic understanding if you really want to get into this field. And
Mm.
also, one most important thing I would say, that start from home. That is, if you are a dental student and you are interested in this field, please talk to your professors who are in the field of periodontology, who are in the field of, particularly, I mean, anybody from the dentistry background can do it, but these these branches are more closely, they work oral pathology, oral medicine, even the pediatric division of dentistry. So if you start talking about it, discuss, give presentations on it, just present posters on in conferences, that is that charity you can begin at your home. Just being a second year, third year student doesn't mean that that knowledge is not with you. Even as an, I'm talking about an undergrad level only, to look into it, go into conferences, present posters, papers. That's how you start searching and you learn about the subject. That is the start point. Do small projects which is within your budget or within your capacity, within the capacity of the institution. So I
Mm.
always believe that if you as a student show curiosity to your professors, I don't think nobody will
Yeah,
tell
they'll
you no.
support it. Yes.
Yeah, of course they will. And
Mm.
professors wait for such kind of curious students to come up. So I think those should be, that is something which I really want to uh, you know uh,
Mm.
tell through your platform. Yeah.
Yeah. Saliva, we actually learn like the pH of the saliva and how it affects the restorations or complete dentures that we do. Thick ropey saliva, the denture will not have the retention. If it is liquid, it will be nice like that. So I
Yeah.
think we learn saliva in the concept of only the dental treatments.
Mm.
But I think we need to go beyond all
Beyond,
that.
beyond, there's a lot into it. Even in prosto, like you're telling, it's about retention, it's about whether it is do we ever ask why? We don't ask why.
We don't ask why.
So please ask why. So you will get the answers. All the answers are in the world roaming
Yeah,
around.
start with why.
Start with why. Absolutely.
So, ma'am, apart from this amazing research and institutions that you are working with, you're also a professional Kathak dancer. So, did anything cross over to your science or communication from that platform?
Okay, no, I mean, I started my dancing journey at the age of 3. So, honestly, I have been a professional dancer when I was more younger. I continued it during my school days and beyond. I have been in the local and, kind of little bit in some metro cities I have done. But honestly, I I would have been the happiest person if I could still do in the professional way. I don't get time, but
Mm.
dancing is, I'm very passionate about. By the way, I don't miss a chance if there is a chance to dance. So I always
That
dance.
is inspiration. Yeah.
Yeah.
Actually, it will become an way of letting go of all the stress in our life.
Of
Like
course,
one
of
of the
course, of course. You talked about communication, then art form is something which is like a stress buster. Well, for me, it has been a very integral part of my life. But now, with time, I think both the things went hand in hand for me. For me, my stress busters are mostly writing, and now that I have LinkedIn with me, so I keep
yes,
writing. Yeah,
yeah.
not that I'm always stressed when I'm writing, but yeah, dancing and writing are my two stress busters.
So,
Yes.
Uh, ma'am, if you're research anything, do you see a creative thread connecting your art to your science?
Yeah. Yes, of course, of course. Because when you are trying to communicate science, you have to have your creative thoughts in place. The first thing first is, how can I break or crush this complex innovation or science or research to a very very simple format which people can understand? How can I not use technical jargons, and what can I use in replacing those jargons? What kind of words can I use so that it becomes more relatable to the people where I'm trying to put out this information? So this is creativity.
Creativity. Yeah.
Absolutely.
Creativity is the essence of storytelling, be it
Absolutely.
in any field.
Any field, yes, yes. Without that, you cannot, I mean, it doesn't exist. These are, it's not separate. Actually, it's like intertwined, like a, how the, we, weave saris like threads, different color threads are weaved. Absolutely, it is like that.
So, what's the one development in oral cancer diagnostics or saliva research that you think will change dentistry in the next decade?
Of course, of course. In terms of early diagnosis of diseases, in terms of understanding where the physiology is going, pathology. So I
Hmm.
think early diagnosis is a key thing for any chronic disease for that matter. And if saliva diagnostics is taken up in the right way, if saliva is explored in the right way,
Hmm.
and if we can innovate, take that exploration to innovations and translating those innovations for the good of the society, for the good of the people,
At a large scale, yes.
it has a lot of potential and it is happening. It's not that we are still talking research. There are a lot of companies in the West who are doing amazing work. And I think in India also, post COVID, I personally feel that COVID has done something good for saliva, brought it up
Yes.
in the ladder a bit. But I think we need to speak more often about it. And saliva diagnostics actually will push or build up the holistic preventive wellness area, because that is where all we are looking into today. If you see the entire health and wellness area, we are all talking prevention, but
Hmm.
we are not much giving focus on diagnosing early. So
Yes.
saliva is that door to early diagnosis of any kind of chronic diseases for that matter, if I have to really make a general statement like this.
It's like, and India is like a kind of the hub of oral cancer. It's the most
Absolutely.
number of cases that are seen in India are of oral cancer. I think it will be a very beneficial to the whole public if it becomes accessible to everyone.
Absolutely.
Yeah. Ma'am, what does beyond the dental chair mean to you personally?
Okay, so beyond the dental chair to me means that looking out in a more wider aspect.
Yes.
Dentist or dental chair, the way we are taught, is not only treating, doing a restoration, treating a pain, just converting a patient to get an implant or some fancy smile designing.
Hmm.
You are, or rather we are, as dentists, we are actually the gatekeepers of health, and we need to
Yes.
understand that. Today we talk about gut microbiome, we talk about many things. Just think your system as a palace. So our mouth is the entry point to that palace. Mouth is the gate. As dentists, we are gatekeepers because we understand what might go wrong in that gate. We need to understand how the oral microbiome ecosystem is sitting out there, because everything is governed from there. So we think that we taste, we think we have a preference. We don't have. It's the microbiomes which are actually controlling us. So, like this, lot of things we need to see and look into it, not just as teeth, gums, soft tissue, hard tissue. It's,
Hmm.
it's not that, it's beyond. Even when you are doing an implant, even you are just doing a simple feeling. And
Hmm.
I feel personally, because I have seen both the worlds of the of the subject. Dentistry is an art. It's tough job. It's not a easy job. But when we also need to understand one thing, that if our approach is not holistic, it's not going to lead anywhere. So when you are scraping that black with your spoon excavator, have
Hmm.
you ever thought, what exactly is this? Why does it look like this? Yes, our textbook, our professors, teachers, they tell us every day. But please ask why. For me, beyond the dental chair would be one thing to conclude, is that that curiosity of a child needs to be triggered in us. Please ask why in everything.
Yeah, thank you. It is such a beautiful thought. Like everything starts with why.
Absolutely.
Yeah.
Absolutely.
Ma'am, where can listeners follow your work, your podcast, and everything that you're building?
I'm sorry.
Where can listeners follow your work, your podcast, and everything that you're building?
Yeah, so I am a LinkedIn person. Please follow me on LinkedIn. I have two three newsletters, like one newsletter on dental genetics, where you will find a lot of articles simplified, written in a simplified way. I have, as told you also, I have a newsletter or a program which runs almost monthly. I try to do it. Sometimes it is not possible. Bringing up global experts from Saliva. It's a conversation. I also put it up all the things on my YouTube channel, which is named as the different news. So if you have missed any live session, or if you are not so much active on LinkedIn, you can always access YouTube. So my channel, where you will get all the playlists there, and you can access all the videos or whatever I have done, or of whatever I have done before and I do now. Yeah.
including the podcast now.
Yes, yes, including the podcast. Yes.
Okay. Thank you for sharing so much information about the saliva, and opening another gateway for the dentist. Like, apart from clinician, you can focus on this and add it to your operatory also.
Absolutely. And thank you so much for what you are doing. It's a great job that you are doing, because I know the pain of doing a podcast, my being a podcaster myself, but I think it's a very very nice initiative, and I wish you all the best. And I wish your channel grows. Sky is your limit, and I think amazing work you are doing, Dr. Saida.
Thank you so much, ma'am. Thank you for your support.
Thank you.